Lot of people these days complain of shoulder pain, not just elderly people. You also have young adults complaining these days about shoulder pain. They have issues around their shoulder muscle, around their neck thing. Tell me what it is. Is it about posturing or is it something bigger?
See, there are two elements with what you asked me. One is the pain in the shoulder, and second is pain around the shoulder. Now, when you look at a patient coming to you, the patient may either come to you with the pain which is diffuse, that is around the shoulder, or he could come with a specific shoulder pain. Now, one needs to understand that these are of different pathologies. I mean, uh, shoulder pain per se could be because of some injury, could be because of some strain in the shoulder joint, or it could be because of an wear and tear, or because of inflammation. Whereas pain around the shoulder, by and large, could be a muscular pain, or myofascial pains is what we usually talk about. That could be related to your posture, ergonomics, and things like that. So it's very important that we understand, is the pain coming from the shoulder or around the shoulder?
Dr. Chirag Thonse, you have been a specialist in this field. Lot of people don't know when to consult a doctor. So I am carrying a niggle here, and I am probably thinking that this is because I have not rested well. I need proper rest, proper sleep. So when do you think as a person should actually visit a doctor for if he is like suffering from a shoulder pain?
Absolutely. It's a very valid point what you've come across. We usually tend to neglect the joint and the body in the initial phases of our problems. So you need to understand that anything in any joint which causes pain, which causes instability, or which causes stiffness are a matter of concern. So the patients, when they come to us for any joint problems, can present either with pain, either with instability, or either with stiffness. Whenever these symptoms persist for more than 3 days, I mean, a simple sprain or a simple strain could be usually taken care of with simple painkillers, rest, icing, so on and so forth. But in spite of all these things, if the pain persists, if an instability in a particular joint persists, or if that joint is getting stiffer day by day, one needs to definitely get it evaluated by a specialist.
Okay. Now that comes to my next question. It's also about these days, lot of people spend lot of hours, many like several hours at stretch on a laptop. So the first reaction is like, okay, it might be something that's related to a bad posture, and if probably I will maintain a good posture and do probably 5 minutes of walk every 3 hours, 4 hours, all kind of knowledge that you get on social media. So if what you are suggesting today, Dr. Thonse, is that if your pain is persisting over 3 days or 4 days and it's a recurring thing, then you must visit a doctor. So you are suggesting that for a shoulder pain, or be it a knee joint pain or a niggle in my ankle, or is it like the shoulder pain is something that needs to be taken seriously? You can segregate between a shoulder pain or a knee pain.
No, it's any joint. Which the comment which I made earlier was generalized to any part of the body, and each part of the body reacts in a particular manner, like how a knee would react, how a shoulder would react. But these symptoms which I mentioned earlier holds good for any joint pathology, any muscular aches which is persisting more than say 3 days or 4 days, and in spite of rest and activity modification, you need to consult a doctor. Of course, it's a very valid point in today's urbanization. With the kind of a work stresses one has, the long working hours, it's very important that one takes care of the posture, because ergonomics and posture forms a very integral part of one's self care and your body and your physical health. So it's very important that you maintain a good posture. That is another topic to deal with. But of course, we will be talking more of the shoulder injuries and pathologies specific to certain joints in today's program, I think.
Dr. Thonse, what do you think are the most common shoulder conditions Indians suffer from?
Yeah, chronologically, if you look at it, I mean, I would segregate the shoulder problem into the problems which are encountered in younger individuals and the problems which are encountered in the geriatric population. Now, younger individuals come to us with shoulder problems which are by and large related to their activities, sporting activities, or injury, fall, so on and so forth. Whereas the elderly population comes to us with either a shoulder stiffness which happens over the period of time, which is called frozen shoulder, or wear and tear, which is called osteoarthritis. Now, the younger pathology, younger individuals come to us with the shoulder problems, which could be either a fall in the field while playing, either because of a road traffic accident, and an individual can have a shoulder dislocation, and when it is ignored, the shoulder joint can pop out again and again, which is called a recurrent shoulder dislocation. This is one of the very common problem why younger individuals come to us. Second, in people who are involved in a lot of overhead activities, like vivid swimmers, people who do a lot of overhead gymming activities, people who are involved in racket sports, they can have a repetitive stress injury and have certain tissues torn inside the shoulder, like the rotator cuff or a labral tissue tear, to be precise, labral tear or slap tear. Thirdly, in people who are involved in contact athletes or people who fall on an outstretched hand, can tear their rotator cuff tendon and can have weakness in their shoulder arm, and they can come to us for pain and immobility.